Hello friends, today we are going to discuss symptomatology, different symptoms and their definitions, their uses and how we all are going to interpret them in a different way. This will help us to analyze a case, to find out a symptom, to understand a particular rubric and to select a medicine also. Start with some basic information. The symptom word has derived from the word symptoma, which means anything that happens. The dictionary meaning is the changes in the body, the perceptible changes. Either they are subjective or objective and indicates the disease or any phase of a disease. This is the condition and not an entity, and it is always manifested by different signs and symptoms. The production of symptoms and signs is based on some physical laws and internal deviation of normal physiology, and it is outward reflection of internal essence of the disease. Here some different definitions given by different homeopathic stalwarts. According to Master Hanuman, the change in the health of the body and the mind, which can be perceived externally by means of the senses, by the patient himself, remarked by those around him, and observed by the physician, is called as a symptom. According to Dr. Kant, every symptom is indicative of a deviation from the normal state of health. Dr. Stuart Claus said in general a symptom is an evidence of disease or a change of a state of health. Likewise, Dr. Dway and Dr. Elizabeth Wright had also given different definitions of symptom. If you refer a different literature, you will come across the different somewhat of 100 types of symptoms, and here some very basic terminologies or basic types of symptoms, starting from common symptom, uncommon symptom. Likewise, you can find these are different symptoms available in our literature. First type of symptom that we are going to discuss is a common symptom. According to Master Hahnemann, it is also known as a pathognomonic symptoms. Those symptoms which are common to all suffering from the same disease, or those are same in a different patients, are called as a common symptom. Examples like pain, swelling, inflammation, mucus stool, vomiting, etc. Their advantage is they are important for diagnosis, useful when they are absent as a what you can know as a negative general symptoms, and helpful when having some characteristic components like intensity, modality and some associative factors. Limitations are they are not useful for individualization and not useful to prescribe a homeopathic similar. Next, uncommon symptoms. They are very peculiar to a patient suffering from some disease. Example like no thoughts during fever, mental and physical generals, any changes, any some intensity, etc. Advantages of uncommon symptom is they are helpful in individualization, they help in selection of medicine, and they are more important with a homeopathic perspective. Limitation is they requires a knowledge and skill to find out, to interpret, and they indicates a few medicine. So you need a more uncommon symptoms to prescribe a medicine. Next, general symptom. General symptom are those affect the patient as a whole or expressed from a whole organism. Generally, the patient is going to denote that I am thirsty, I feel appetite, I am hungry, etc. Then some general expression like some sensation expressed from more than two part or two system, like bruised pain, burning sensation, etc. Their advantages, they expressed as a whole, so they are more important as a constitutional or characteristic feature. They expresses the individuality of a patient and helps in a differentiate the medicines. Limitation is not important if not characterized, and if patient is described them very vaguely, they becomes very general. Then next is mental general symptom. It is a type of a general symptom, most important according to Dr. Kent to prescribe a medicine. They are related to a mental state, disposition of mind. According to Dr. Kent, we can differentiate or we can divide them in three categories: will or emotions, intellectual, memory. Their importance is they reflect the inner self of a patient, helps in individualization, and helps in the medicine selection. Limitation is they are very difficult to inquire, again difficult to interpret, might be not available in every case. Next symptom is physical general symptom. That's another type of a general symptom. The symptom which are related to a body as a whole, conditions and circumstances which affects the body as a whole, they are known as a physical general symptom. In examples, we can take a bodily secretions, like if you take as a character of stool, character of perspiration, character of urine, and if they are indicating a same characteristic, they are known as a physical general symptom. The patient's desire, aversion, thirst, thermal reaction are included in a physical general symptoms. Advantages: in absence of mental symptoms, you can use the physical generals to differentiate the medicine and for prescription. In comparison to mentals, the physicals are more easy to inquire and interpret. Limitation: not every time we are going to get the exact characteristic nature of physical general symptoms, and they can misguide us if patient describes them very vaguely or superficially. Next symptom is particular symptoms. Those symptoms which are related to parts, organs, tissues, or system, they are known as a physical particular symptoms. Like example in headache, abdominal pain, pain in joint, etc. Advantages or usefulness: they helps in a diagnosis or prognosis, and they help in a therapeutic prescription when we are not having any mental or physical characteristic symptoms. Limitation is mostly they are common to the disease. They need modality or concomitant to evaluate them, and strong general can overrule all particulars. Next type of symptom is subjective symptom. Those symptoms which can felt by patients only or experienced by patient only, and no one can interpret or experience those patients, and they are known as a subjective symptom. Example size: pain, then desire, some modalities, some mental sensation or mental feelings, etc. Advantages: more important than objective symptoms for individualization. According to Master Hahnemann, the physicians must rely on the sensation or explanation of a patient only, as he has described in aphorism number 98, that in mouth of patients sometimes the subjective symptoms can erroneously altered because of their own feelings. So we have to rely on a subjective symptoms rather than objective symptoms. as they reflect the innermost part of a person. Their limitations are their errors in perception and interpretation on the part of a patient will misguide a physician to a wrong medicine, and mostly they are described in common terminologies. Next is objective symptom. The symptoms which are observed by patient himself, bystanders and physicians are known as objective symptoms. Examples like swelling, discoloration, behavior, gestures, physical, constitutional symptoms, etc. Advantages: they helps in a diagnosis, easy to find out. In absence of subjective symptoms, one has to rely on objective one, and they find palliative medicines. Limitation: not for individualization. Removal of them does not mean removal of disease. Clinical symptoms. In homeopathy, the clinical symptom means those symptoms which are not proved during drug proving, but they have found cured during the clinical practice. Example like stitching pain of bryonia is a clinical symptom. Advantage is important to find out secondary symptom, can know medicines related with the disease, and it increases the knowledge of Materia Medica. Limitation: not easy to confirm, very rarely appears in all cases, needs study of many cases to confirm them. Next, peculiar rare symptoms. Their characteristic symptoms like modalities, characteristic sensation, etc. They help in individualization and must be found very cautiously to prescribe a medicine. Next is a complete symptom, the first time given by Dr. Boni Hussain. They are having four main components: location, sensation, modality, and concomitant. And they are the most important on to prescribe a medicine when you have only particular symptoms or you are lacking in a mental and physical generals. Keynote symptoms, they are PQRS or striking or very uncommon symptoms. It is like modalities, desire, aversion, etc. If patient reflects three or more than three symptoms, you can prescribe the medicine on the basis of keynotes. Limitation is many stalwarts has contradicted those kind of practice based on keynote symptoms. Next is determinative or characteristic symptom. This terminology is used by analysis in clinical method. Those indicate peculiarities of patients, craving or aversion, mental attributes, etc. They are helpful in individualization, selection of medicine, etc. Next is pathological general symptom. First time given by Dr. Boger in Boger Boni Hussain's characteristic repertory and his analysis and evaluation, that pathological change is reflected as a general expression of a patient. We can take those symptoms as a very characteristic to a constitution. Examples like discharges, tumors, cancerous growths, etc. Importance is their expression of constitutional changes, so they are very important to find out a medicine. Next, alternating symptoms. Alternating symptoms are those symptoms where two state of disease or two different symptoms alternate each other at a particular time of interval. Examples like constipation alternates with diarrhea, difficulty in breathing alternates with eczema. Advantages: In many patients, it is a very characteristic time relationship, and it indicates direct similimum. Next is accessory symptoms. Definition: the patient feels some symptoms are a part and parcel of his healthy life and not give much credence to them. In aphorism number 95, Master Hahnemann has described about lesser accessory symptoms and its importance. They are very characteristic if available in case, and we have to find out their characteristic component to prescribe a medicine in a chronic cases. Next, concomitant symptom described by Dr. Boning Hussain as unreasonable attendance. The definition is they are not having any physiological or pathological relationship with the chief complaint, but they are still present with the chief complaint. It helps in individualization and selection of similimum when we have only complete symptom available in a case. Next terminology is maze of symptoms. When you have so many symptoms in a particular patient, then those kind of conditions you are going to observe. In hypersensitive patient or in idiosyncratic patient, we can observe this kind of large number of symptoms. Last is eliminating symptom, terminology given by Dr. M.L. Tyler to repertorize the particular cases. When the symptom eliminates the unwanted medicine is known as a eliminating symptom. There has to be a most general or most characteristic symptom of a case to select a particular similimum medicine. Next is paucity of symptom. When we have absence of characteristic symptom, then we are going to use some different method to evaluate the medicine. Last is negative general symptom. When a symptom generally supposed to be present in a particular case but it is absent is known as a negative general symptom. Example is no thoughts during heat stage, painlessness and inflammation. They are very characteristic symptom and they indicate some medicine which you can prescribe. Next is diagnostic symptom. They are helpful in diagnosis and they are not helpful in any particular homeopathic prescription, but they are helpful in diagnosis of a disease. So friends, today we discussed about some important symptoms which are useful for a homeopathic practice and to homeopathic study. You can visit some my blog or my website for more information, and also you can write down your comments and suggestions for the same. Thank you.